Hi, everybody. Great to have you here. I'm Michael Miyasaki, and today we have Dr. Ryan Walsh, a true endodontist. And we're going to be talking about something that may seem a little simple. We've talked about the indicator, we've talked about all the irrigants, we've talked about so many different things, activation and things. But today we're going to talk about something that I think everybody needs to know about, and that is that Vista Apex. We have syringes that are color coded. So I know in the past we've had the kind of clear plastic syringes, and when my assistants put sodium hypochlorite in it or EDTA, they had to label it by hand with a Sharpie, uh, and it would have that on there. And sometimes they'd load it up and it would get rubbed off. And I'm trying to figure out, okay, what is it that's in that syringe? Well, what we're gonna do is we're gonna talk to Dr. Walsh about how the color coded syringes have benefited him in his endodontic practice. So, Dr. Walsh, great to have you here. Thank you for joining us.
Dr. Mike, so glad to be back. Thanks for having me again.
So, give me your take on these. I mean, it's like I said, it's kind of the easier basic part of the equipment, but it's so important because we've talked about irrigation is such an important part of endodontics, and just having things that are color coded make it so much easier. So, how's it helped your practice?
Yeah, I mean, it seems so obvious, right? But it's something that we've been doing for a really long time. I mean, 5 years probably. We've been using our color-coded syringes, and for the simple fact that it's easy to see, it's easy to identify, and not only for me, but honestly, more importantly for my assistants, they're the ones who actually started doing it.
Hmm.
And so just for ease of workflow, they started filling EDTA with blue and, our hypochlorite rinses in red. And so it just made everything really easy for them to see. So when they're transitioning between, it's a no-brainer. They don't have to look, like you mentioned before, we used to just write with Sharpie EDTA or regular or whatever. We call it regular instead of hypochlorite. But yeah, it's one of those things that my lead assistant noticed this 5 years ago that Vista had these color syringes and started doing it, and as they say, the rest is history.
Well, if we go back, so Vista Apex, we have four different colors. We have the red, and as you
Oh.
mentioned, that would be a good syringe for your sodium hypochlorite or your chlor extra because we don't want to have a sodium hypochlorite incident. So red would be good just to know that that's the one to be cautious with. The
Mhm.
blue would be really good for something like you mentioned EDTA or the smear off 2-in-1.
Mhm.
And then the white one or the clear regular syringe would be good, I guess, for like a rinse. If you're using sterile water for the indicator, that'd be
Exactly.
a good one to use. And then there's a yellow color, and the yellow color would be a great one for something that's close to your heart, is the endosealer solvent.
Yeah, that is exactly how we use them. That's exactly how we use them. So, EDTA. So we start with red because it's kind of like, hey, red. You think of stop, you think of caution, you think of things like that. And so, sodium hypochlorite's the perfect one to plug into that for that exact reason because red really catches your eye, so you know exactly what you're using. And that way, it's like you're not only are you cautious with it, but you're not only cautious in the tooth, but cautious not to get it on your scrubs and not to accidentally drip it all over, all over the place. Anyway, so for us, yeah, that's an easy answer. Blue EDTA, just because it's a nice contrasting color and it's you don't have to worry so much about EDTA. It's just uh, a chelating solution. So you don't have to worry too much about getting out, getting over the patient, getting on scrubs or around. And so, yeah, for us, that's kind of an easy transition. And then here recently with the advent of sealer solvent, that's where we've started using the yellow one to use that as our color code because it's closest to the orangish yellow that's on the label. But yeah, I mean, I don't want to over make things over complex and don't want to oversimplify, but it's pretty much a no-brainer. They really match the labels that are on the Vista irrigants, and so that's what makes it even easier. Is that chlor extra, hypochlorite, they're already red. The label's red, so you just match that with the color syringe. Same with EDTA being blue. I mean, Vista's done a good job of consciously or unconsciously matching these colors real well for us, so that we can plug them onto our syringes and make our workflow that much easier.
Yeah, no, I'm glad you mentioned that. So yeah, just in case anybody forgets, Dr. Walsh is absolutely right that this Apex purposefully they went back and changed the colors of all the labels so that they'll match the syringe color. So you're absolutely right. You know, your sodium hypochlorite is going to be the red label for the red syringe. EDT is going to be the blue label for the blue syringe, and the sealer solvent is kind of like an orange label, which is kind of like the yellow that the syringe is made out of. So no, it's yeah, it was done purposefully, and we're lucky that they had all the colors that they needed. And then one of the things that we were going to mention is that when you get the more premium bottles, the Chlor Extra, the Smear Off, the EDTA, and the CHX Plus, that
Mm.
those bottles have what we call the Lure Lock bottle cap. And so the Lure Lock bottle cap means that you can just take a Lure Lock syringe, preferably color coded to the bottle that you're extracting the irrigant from, and you could screw that onto the bottle cap and then withdraw the solution because the cap has a tube that goes down to the bottom of the bottle. So I know in the past, the way that my assistants have done it is they poured whatever the irrigant was in a cup and then put the tip of the syringe in that cup and then withdrew the fluid and then just kind of poured the irrigant back into the bottle. Just a lot of waste, and a lot of chance of spillage, and now we don't have that. So how's that helped you? Because we were talking about that your team really likes to use those bottle.
Yeah, I mean, it's one of those really small things that makes a really big difference to my assistants. Um, yeah, again, something that I just kind of assumed came with everything, but it's so easy and simple that yeah, there's no pouring of any solutions anymore. All of our solutions now have that lure lock cap where you literally just twist on the syringe, pull it back, fill it whatever you want, 3 cc's or 12 cc's, whatever you'd like, and unscrew it. It's dripless. There's no drips. There's no mess. You don't have to have a separate little beaker to pour the solution into. No risk of spilling hypochlorite or bleach or anything else for that matter. It makes life really easy. And like I told you a few minutes ago, it's a really simple thing that is a total value add to our workflow and just streamlines things even further. And one of those little things that now that we've lived with it so long, we're just accustomed to using it. It makes life really easy.
Yeah, no, I agree. And so the syringes come in two different sizes. I think it's a 3 cc and a 12 cc. Do you guys just use the big 12 cc for most of your cases, or do you use the three at all?
Yeah. So most of the time for our sodium hypochlorite, I use Chlor Extra. My partners use Chlor Extra. That's just our go-to standard irrigant. And we use 12 cc syringes for that. Our EDTA, we use 3 cc's. And if we're using alcohol or distilled water, we'll use 3 cc's for that too, simply because we just don't need quite as much.
Mhm.
But yeah, generally, uh, 12 cc's for the hypochlorite, whatever, and we'll go through one or two of those per case, depending on how much is there and what we're doing. But we try to get as close to 20 cc's per case as possible. Yeah, especially most of our cases are molar, so we're trying to get 5 cc's per canal roughly. In an anterior case, they're just bigger canals; they have more volume. So I'm trying to get at least 12 cc's through an anterior single root case just because more is better in this case. You can't really over irrigate. I've never heard anybody say they use too much sodium hypochlorite during a root canal. It really just doesn't exist. So yeah, we'll use 12 to 20 cc's of sodium hypochlorite, and then yeah, just 2 or 3 cc's of the EDTA. So drop to the small syringe for that.
That's great. And then, are you using the clear ones? Do you use sterile water, or how do you rinse out in between the different types of irrigants?
So in general, I don't rinse anything out between EDTA and hypochlorite. I just go from hypochlorite all during instrumentation, EDTA, and then right back to hypochlorite. You can use distilled water to rinse between, although I think that's one of those cases where you really don't need to. But if it trips your fancy to rinse something between, totally. So then use a clear one because you just know that it's not hypo or EDTA.
Mhm.
You could also use a little alcohol, whether it's isopropyl or ethyl alcohol, just to rinse through. But if we're going to do distilled, predominantly when I'm doing the indicator, I'll have a small, or we call them small, but 3 cc syringe where I flush about 2.5 cc's through the canals real quick, just to kind of get any residual irrigant or debris, and then I aspirate back that half to one, so I can put that on my indicator swab and get a good measurement.
That's a great suggestion. Let me ask you one more part of that. Just it's a kind of a detail, but when you're using that, you're rinsing out the last part before you're going to extract a little bit for the indicator. Do you need still water? Is distilled water work okay? Or is there, have you noticed a difference between any of that, of the last irrigants to do your, before you do your testing?
Yeah, I have not noticed any difference. And I've used saline, I've used distilled. I really don't think it matters a whole heck of a lot because we're testing for ATP. So if you
Mhm.
have saline, which is um, sodium chloride, salt water, or have distilled, it really shouldn't matter or impact things a lot because you're really just trying to stir up any potential either bacteria or vital tissue or blood or drainage that's still in the canal so that you can put that onto the swab. So I found that it really doesn't matter. I use distilled now just for ease of convenience. And I mean, there's no cost to using distilled. We already use it for our autoclaves. And so we know we have it just laying around. And so we'll go through that enough that it's not just sitting. So yeah, I use distilled just kind of out of convention.
Yeah, no, thanks for answering that because I know with the indicator being as new as it is, that there's a lot of questions about the little details of what we're doing. And again, the syringes, the color code syringes really work really well because I think in order to get those really low indicator scores, the irrigation is going to be a really important part of that. Otherwise, you're going to have some tissue hiding
Yeah.
somewhere down there with some ATP that's going to throw off your readings.
For sure. And I mean, especially, as an endodontist, we're doing this multiple times every day.
Yeah.
But for a general dental office or even a pediatric dental office, I spoke to a pedo group this weekend. And when you're not doing them all day, every day, things that kind of key in your assistants and your office staff to help streamline things and make sure that, okay, I have my EDTA. Great. I have a blue syringe. Make sure you have your hypochlorite. Great. I have my red. Kind of mental notes and mental checks as you move through just make things easier and more streamlined so that it's predictable all the way through.
Cool. And I think the last part of this protocol I'm going to ask you about is the tip. So, we've got the syringe, we talked about the irrigants, we talked about everything, but that tip, when we place the tip down into the root canal, we want to be really safe. We want to get the irrigant down there, but we want to do it safely. Do you use the VIP irrigating tips or do you use the dual side port tip of any sort that you recommend?
Yeah, both VIP and the Aplivac tip.
Hmm.
So either one, I think, are perfect for endo irrigation. It's just so important to not have a blunt tip. We've used Aplivac for years and years and years because it's side vented. And so it just kind of has a bevel, kind of a shaved off bevel at the root tip. So we know we're never going to get that plugged. But the advantage that I like of the VIP tip is that it's dual ported. So you get action in both directions. So if you're putting it in there, especially as a final irrigant, and you just give it a little twist, you know that you're getting a final flush down at the apex in kind of all directions circumferentially. You're not just plugging it down there and hitting the walls. And so just that last little bit of flush, it's just a nice peace of mind.
Yeah, and because it is side vented, there should be a lot less chance or risk of any kind of extrusion of especially the sodium hypochlorite, I would assume, because I've taught to doctors and some are afraid of using sodium hypochlorite, which we consider as kind of a primary irrigant to disinfect and dissolve the tissue. But I
Yeah.
know I taught to a doctor within the last month that had a couple episodes of sodium hypochlorite incidences where it just really scared her to use it. And I said, well, if you use the side ported needles, even if you jam the tip down at the apex, the irrigant can't go out the apex because now you sealed it up. And with the side ports that irrigate the irrigant sodium hypochlorite just go out laterally. It shouldn't go out apically. So yeah, I think that's a really important part of the protocol.
Yeah, 100% spot on there. That and even if one side's bound, it still has port out the other side that's not directed apically. So
Hmm.
everything's pushing back up coronally there, and I mean it's just a really safe way to irrigate. Whether you've had incidents, hopefully not, or you have, it's like that's a nice kind of fallback to know that there's really no way to get it past the apex as long as you're not intentionally extruding it.
Yeah, and and one other part about that dual side port is because there's two different ports, it seems like there's a little less resistance when you're actually placing it down and trying to get it down the canal. You're trying to be really careful not to jam it down into the apex, and so you're trying to I like pump it a little bit and I'm trying to
Yep,
extrude it with a little gentle pressure, but having those two side ports just makes it seem like there's a little bit less resistance than if you only had one. So I don't know. That's
totally.
yeah.
Yeah. And the tip is well designed that you can actually pre-bend it a little bit. So if you have
Mhm.
like a nice sloping curve, you can easily pre-bend that so you can get it down there within a couple millimeters of the apex pretty easily. And again, rest assured that it has the dual side ports, so you don't have to worry about extrusion.
Yeah. No. You know what? It's funny because we started off talking about okay, we're gonna talk about something that's kind of really basic, the color code syringes. But it's kind of like going down the proverbial rabbit hole or I guess the root canal system, as you kind of go from top to bottom. Some of the details that you covered with us today are great. Okay, we've got the color code syringes. We're gonna fill those up. We have the Lure Lock bottle cap, and then we've got our side ported irrigation needles so that we're not going to have to worry about any kind of extrusion of our sodium hypochlorite just for safety for us and our patients. And as long as we're doing all this, we're going to have great success. And the color code syringes will make your life easier because remember, the syringe colors will match the bottle of the irrigant. This Apex has done that purposefully. So if your assistants get a little confused, just have them look at the bottle, match the colors up, and then it's just up to the team. And now you don't have to worry about if they use a Sharpie and they write sodium hypochlorite or the chemical abbreviation, and that gets rubbed off, and you're sitting there like, okay, I can make out a couple lines, but what is that? And sometimes
Totally.
nobody can remember.
Well, yeah, and like you mentioned, it's not just for you, the doctor, to know what's what's in the syringe, but equally for the assistant and for the rest of the staff, because sometimes one assistant fills or sets up the room and the other assistant's the one with you, and so they don't have to worry about juggling things back and forth. It's just you just look down, you see blue, you know it's EDTA, red, it's hypochlorite. That makes life so easy.
Yeah, you're absolutely right. Well, Dr. Walsh, thank you very much for your insights from the perspective of an endodontist. And every time I have a chance to discuss the procedures with you, I know I learn a lot. So I'm not that smart, but you're making me look smarter. So thank you very much.
Well, thanks again for having me on, Dr. Mike.
Yeah, real quick, if you guys are watching this on the YouTube channel, please hit like if you liked what you heard today. Hit subscribes to make sure that you don't miss an upcoming program. Make sure that we advise you. And remember, again, we're just trying to create a community of like-minded clinicians, trying to do the very best for the patients, whether it be endo, resto, preventative. And yeah, we just really enjoy having you here, and we look forward to seeing you during the next program. Thank you very much.